Okay. We should be starting with the YouTube. Can everybody see everything? Still the PowerPoint? Okay. Thank you. All right. We'll be starting as okay. So just quick introduction myself. My name is Mark Brahmanov. I took my MCAT in January and scored 520, and this is my score breakdown. My email's on the screen as well. If you want to take a picture, write it down. If you ever have any questions for me, you can always contact me through email, and I'll give a response as soon as possible. This is a 15-week full course. I believe we're in week 9. This is the second lecture of week 9. 3 lectures per week, Thursday, Friday, Saturday, and office hours on Sunday. All lectures and office hours 8:30 p.m. Eastern Standard Time. We also have a group meet, which Chris, the other tutor here, will post in the chat if you're not already part of it. All the lecture links and PowerPoints are posted. We'll also be posting any updates or changes there as well. It's also an easy way to get a hold of me or any of the other tutors or even many of the other students. I believe there's over 400 people in the group meet, so somebody will have an answer for you if you have a question. Yeah, it's a great way to reach out to us and get answers to your questions. What we'll be covering today is attitudes and different types of therapy. This is mainly focusing on the psychosocial section. So we want to cover what are the various aspects of attitude, what is attitude and how is it different from behavior. So that's a pretty common topic, I would say, for that section, is the differences between attitude and behavior and knowing the definitions of each. And what are the different types of therapy and how can we differentiate between them? Okay. So moving on to the content. First, we have attitude. So attitude is defined as the expression of a feeling towards a subject. Very vague, very general, non-specific definition. Just an expression of a feeling towards something. There are 3 main components that make up attitude that we consider for the MCAT. There's the affective, the behavioral, and the cognitive aspects. An easy way to remember them is the ABC, right? Affective, behavioral, and cognitive, ABC approach to attitude. And we'll go over each one of these 3, okay? So first up is affective. So affective is the emotional component of attitude. It's just how you feel about a certain subject, and in order to be effective, you have to have some kind of, it has to be tied to some kind of emotion or some kind of feeling, right? It's not like an action or anything like that. It's just an emotion, right? So for example, I'm gonna have an example that I'm gonna come back to for all 3 components. So there's a negative example and a positive example, because you can have a negative attitude towards something and you can have a positive attitude towards something, which I'm sure many of you experienced both of these in your lives to different things. First is the negative example. So the affective component of your attitude towards spiders, which could be something that most people are negative towards or have a negative attitude towards. It could be spiders are scary. This is affective because it only conveys an emotion or a feeling, fear. So your feeling towards the subject, spiders, is spiders are scary. They make me feel fear. A positive example could be something like your attitude towards your friend. I'm assuming most of you like your friends and have a positive attitude towards your friends. So the affective component of your attitude towards your friend could be, my friend makes me happy. Again, we're looking at, for affective component, we're looking at an emotion or a feeling towards the subject. In this case, the emotion is happiness, and it's directed towards your friend. Okay, very simple so far. Next is the behavior component, the second component of attitude. The behavioral component is how we actually behave with respect to the subject in question. It refers to physical actions. And this is a big part of the difference between attitude and behavior. According to this ABC definition of attitude, behavior is a part of attitude, but it is not attitude itself. And the main difference is that attitude is your overall feeling or your overall feeling or action towards an object, whereas behavior is just how you behave, like how you act, how you physically act towards a certain subject, right? It's kind of hard to explain without using these words, but hopefully you guys get the gist. So going back to our negative and positive examples, for behavioral component, your negative behavioral component of attitude towards spiders, for example, could be when you see a spider, you either run away from it or you can try and kill it, right? That's when you see a spider, any kind of bug, that might be how you behave towards it, what you physically do. The positive friend example, what you physically do or your actual actions is you try and talk with them, spend time with them, hang out with them, do more activities together with that person, right? And that's how you actually behave and act. The last component is cognitive, and the cognitive component is essentially how you connect the previous two components in your mind. So we have a feeling or an emotion, and we have an action. But in order to really tie these together and make one cohesive thing called attitude, we need something to kind of bridge the gap. Cognitive is essentially a justification of your affect. So while affect is simply the emotion towards a subject, cognitive is the logical reason for such an attitude, right? For your actions, for your feelings and your affect, it's actually the logical reasoning and the justification that you have for your attitude. For example, now we want to bring everything together since we've talked about all three parts. We'll go to the negative spider example. You are afraid of spiders. That's the A component, affective. You feel fear towards a subject because they can be poisonous or they can damage you in some way. That would be the cognitive. It's the logical reason. Your fear that you feel, the affect, is justified through this cognitive because they can be dangerous, they can be poisonous, they can do whatever. Or actually venomous, not poisonous, but regardless, they can be dangerous. So either you run away or you kill them in order to avoid being bitten or hurt in any way. And that's the behavioral component, the actual action. You feel an emotion, you feel because you feel an emotion for this reason, and in order to counteract that emotion, you perform some action, right? In order to get away from that emotion or to kind of satisfy that emotion. In this case, it's to get away from it or to conquer it. In other examples, it may be to kind of like go and coincide with it. For your friend example, the positive example, your friend makes you happy. Again, that's the affective component. You feel happiness, you feel an emotion towards a subject, which is your friend, because you have fun together, you enjoy the time you spent with them. That's the logical reason. When I spend time with them, I have fun, I enjoy myself, I learn new things or whatever it is with your friend. And that's like the logical, factual reason that you feel that emotion when you're with them or towards them, that you feel happy, or you feel love, or you feel some kind of emotion towards your friend, because you enjoy spending time together. Because of this, you choose to talk with them or hang out with them when possible. That's the actual action. You have an emotion, happiness or love or whatever. Sorry. Sorry about that. You have an emotion, happiness or love or whatever. It's justified because of your cognitive aspect of attitude. You have fun together, you learn new things, you enjoy spending time with them. And because of that, you act on that emotion. And for that reason, you perform some kind of action. You talk with them, hang out with them, do whatever with them. Okay. So if you just combine all three components, this can essentially be described as an attitude. This whole thing, it covers every aspect of attitude. Usually, an attitude may be a little bit more kind of further developed, but this is kind of like the streamlined version of, according to the ABC definition of attitude, this is basically it. It's very simple, very straightforward so far. Before we move on to our first quick question, does anybody have any questions, any clarifications, anything about anything I've covered on so far? Okay, if not, then move on, and feel free to ask any questions. So I'm going to start the poll. Okay, take another maybe 30 seconds to a minute to answer this question. Okay, I close out the poll. Okay, so the majority of people picked choice B, with second place being choice C. So I would narrow it down to those, but however, I think the correct answer is actually choice C. The reason is, so firstly, going over these, it's not attentive because that wasn't part of the 3 aspects of attitude. It's not affective because it's not really dealing with specifically an emotion. It is dealing with your attitude towards chimps, but not really your emotional attitude, whether you love them, hate them, or afraid of them, whatever. That could be part of the attitude, but it's not exactly, that's not how you would exactly test it. Something that would test the affective would be more like, are you afraid of chimps or something like that. Now between B and C, so the reason it's not B is because it's really hard to, through a survey, to test for your behavioral aspect of attitude, right? Because like I mentioned, behavior is an action. So the way you would test usually a behavioral aspect is by having somebody actually perform some kind of action or some kind of physical thing, right? It wouldn't really be by doing a survey. The reason it's C, cognitive, is because if you have had, in your previous experience, if you had some negative experience with chimps in the past. For example, the only time you've ever seen a chimp before, it was very violent, it was very aggressive, it was hostile, and it was dangerous, right? If that was your only exposure to chimps in the past, that was your previous experience, which is what the question's asking, or the survey is asking in the question, then you would have logically, you would say, well, my previous experience was that they're violent, that they're aggressive, so because of that, I have a negative attitude towards them. It's the cognitive aspect, because you're deciding whether logically you should or should not be afraid, or logically if you should or should not approach this with a negative or positive attitude, right? If, for example, the only exposure or the previous experience you've had with chimps is very positive, you found them to be very cute, very loving, very very nice, essentially, or you just had positive experiences with them in the past, logically you would conclude that you should have a positive attitude towards them because they're nice animals, essentially. And you would have, through the cognitive aspect, you would have a positive attitude just based on your previous experience, right? So usually surveys can either ask for affective or cognitive. They usually won't ask, it won't be behavioral. Behavioral will usually be something that you can actually act upon, or that has you actually doing something. And we'll go over more of that when we talk about therapies in this lecture a little bit later, right? There's a lot of therapies that involve behavioral exercises, but surveys are usually not one of them. Those are usually more cognitive, or sometimes they can be affective depending on what question they're asking, if they're talking more about emotions or logic. Okay, in this case, it's talking more about logic. So it would be C. Does that make sense for everybody? Does anybody have any questions, concerns about that? All right. Moving on. So now I want to talk about changing attitude and behavior, right? So sometimes people may have certain attitude towards a subject that they don't really like, or that's not really good for them, and they want to change it. How would we go about that? And that's something that goes more into actually the medical side. So we've been talking about the actual psychology, but since the MCAT is more focused on medicine, we want to kind of shift that into a more application-based kind of thing, right? So the main way to change long present attitude and behavior in a person is through something called therapy. There are many different kinds of therapy that approach the issue in different ways and focus on different aspects of behavior, of attitude, right? And they take different approaches to changing it, right? Therapy is often used to treat unhealthy or damaging attitudes like extreme phobias. One example of extreme phobia could be a crippling fear of heights that prevents somebody from even being able to climb stairs or willingly be above ground level, even indoors. So we wouldn't really use therapy to change a fear of, kind of a mild fear of spiders or snakes, or a mild fear of heights. If you're afraid of skydiving or roller coasters or something like that, that's normal and there's no problem with that. And you wouldn't really get therapy for that unless you really wanted to, but usually that's not the case. Therapy is usually used for extreme and damaging phobias or any other kind of attitude. For example, we'll see others. Some attitudes could be depression could be considered kind of like an attitude, because it's your attitude towards yourself or to life or something like that. These can interfere with your everyday life. Like, for example, like I gave this crippling fear of heights. If you can't even climb stairs or be on the second floor of an indoor building, that might interfere with your daily life, with your school, your job, your relationships, everything like that could heavily interfere with your life. And so we try and treat that with therapy. We try and change the attitude. There's many different, like I mentioned, there's many different types of therapy, and we'll be going over each one individually. First up is the simplest, behavioral therapy. So behavioral therapy is an action-focused approach to therapy. It spends very little time focusing on the feelings, the logic, the subconscious, anything like that, your thinking, but rather it has the patient focus on actually changing the behavior. And through changing behavior, it changed attitude. This type of therapy is commonly used for phobias, anxiety, substance abuse, and OCD. Okay. Some examples of behavioral therapy are aversion therapy. And we've kind of covered similar ideas before. So aversion therapy is where the patient learns to associate the unwanted behavior with something negative. For example, if we're talking about substance abuse, through aversion therapy, we would give them maybe a small dose of their drug that they're addicted to, or there's the substance that they want to unlearn the behavior of, or unlearn or change their attitude towards. And then we would give them something negative, maybe like a shock or something else. And through that, we would try and change, and we would kind of make it associate doing that behavior that we want to get rid of with something negative, the other side effect. And through that, we would eventually, hopefully, get rid of their behavior by making them not want to do it anymore, because they would associate doing that behavior with that bad thing that's happened to them, the shock or the pain or whatever. This idea is very similar to operant conditioning, which we learned about earlier. Again, you're being conditioned to not like the behavior that you are currently doing and want to change by tying it to something that is unpleasant. As you may expect, that's very commonly used for substance abuse, or could be used for like anxiety or OCD or something like that. But mainly it's for like substance abuse or something like that. And again, notice how, because this is behavioral therapy, doesn't care about your feelings, doesn't care about any logic or anything like that. It's just focused on actually changing the behavior. It's not touching the subconscious, why you are using drugs or how you feel about the drugs or whatever else. It's just focusing on the actual action of actually using the drugs. Another example of behavioral therapy is desensitization. So you gradually get exposed to the source of fear to slowly remove it. This is this could be used for drugs, just in a gradual, I guess, unexposure or removal of the source of addiction, right? And it's just kind of, especially for phobias or anxiety, this is used for. If you're afraid of, say, dogs, first they'll maybe just have you write the word dog a bunch of times. Then they'll slowly start to show you pictures of dogs being happy and playful. Then they'll show you videos of dogs. Then they'll give you a toy that's a dog. Then they'll have you in the same room with a dog that's very far away. Then they'll have you closer to the dog. Then they'll have you touch the dog. And eventually, hopefully that gets rid of your fear of dogs over time, but very gradually, very slowly. Again, doesn't focus at all on how you feel or what your logical reason for disliking dogs is. Mainly, it only focuses on, we're going to get you to be comfortable around dogs, not be afraid or running away every time you see a dog. Right? It focuses on the actual action, the behavior. Next is flooding. This is another example of behavioral therapy, flooding. So it's similar to desensitization, but whereas desensitization was a gradual exposure, like I mentioned, you see a picture, then you see a video, then you stay in the same room, then you actually get to touch it, whatever. It's very gradual, it happens over time. Flooding is the exact opposite. It's very rapid exposure to a source of fear. For example, if you are afraid of, again, if you have a crippling fear of heights, they may just put you on like the 5th floor of a building straight away. And they'll just show you, look, nothing's happening. You're on the 5th floor of a building, and they'll have you stay there for a while. You'll be terrified, but you'll see that there's nothing happening. And then eventually it'll kind of like shock exposure therapy, right? But yeah, that's fine. And you don't really have to memorize these. You can if you want to. I'm just giving you examples so you get an idea of what behavioral therapy is and what the difference is between this and the other therapies that we're going to cover. You don't really have to know these. You don't really have to know what they're commonly treated for, but they may ask you, for example, they may describe aversion therapy just like I'm describing it here, and then say what type of therapy is this a type of or subtype of, and then you'll be expected to know with behavioral therapy, not necessarily because you remember aversion therapy is behavioral therapy, but because they expect you to be able to figure it out based on the description of aversion therapy. Okay. Similar, they may say like substance abuse. We're going to be treating a patient as substance abuse in this way, and they'll describe some type of therapy. And they'll ask you what type of therapy is it, and you'll have to say it's behavioral, or it can be something else, right? One of the other types we're going to talk about. Any questions on behavioral therapy before I move on? Okay. The next type of therapy is very similar, with a little bit extra added onto it. It's called cognitive behavioral therapy, and I think this is the most common one that you'll see on the MCAT, or the most popular one. It's similar to behavioral therapy, except now it adds in some cognitive aspects as well. So while the patient will be undergoing action-based behavioral therapy when they're with the doctor or the therapist, during the sessions, they'll also is a slight focus on the underlying thought patterns associated with behavior. So they're adding in a little bit of the cognitive aspect, a little bit of the logical thinking aspect. So it doesn't focus on past traumas or events or any types of feelings, but rather focus on thought patterns you have now and how they change over the course of therapy. So for example, it might not focus on the reason behind a certain condition. So for example, this is commonly used for mood disorders like depression, bipolar, phobias and anxieties, eating disorders, insomnia. It's not looking for what got you into the phobia or the anxiety or the eating disorder or whatever else. It's not focused on what thinking got you there, but rather what are you thinking right now, and how is that thinking going to change over the next month or 2 months that we're going to be working together. Whereas behavioral therapy is almost exclusively, I would say, done in sessions with a therapist. Cognitive behavioral therapy is done, it has the behavioral therapy aspect of being done with a therapist, but it also has another aspect where it has some cognitive thrown in between the sessions. So I'll go here. So some examples are homework. So cognitive behavioral therapy often involves homework outside of the therapy session. So one of the most common ones is keeping a journal to document your thoughts in between sessions, which will show the change in the cognitive aspect over time. So you show up to your session, you'll do some therapy, some behavioral therapy with the doctor therapist. You'll write down some notes, and then when you go home before next week's session with the therapist, as you're going about your life, you'll document in a journal thoughts that you're having as you're having them. So for example, if you're trying to treat depression, if you have a sudden thought or something like that, in between one of the sessions, you'll write it down, right? And that'll show you your thought process during different events that happen in your everyday life. And that'll highlight the cognitive aspect. And then hopefully, if the therapy works, over time, you should notice that your thinking actually changes from from week 1 to week 7 or week 8. Actually changes over time, and that'll be shown through the notes. Another example is rational emotive therapy. So you learn to challenge your irrational beliefs and replace them with more rational ones. Again, if you're talking about something like a phobia, then if you have an irrational phobia, like an irrational fear of heights or something like that, where if you're afraid of even being in a building that's more than 1 story, that's kind of irrational. So you do like I mentioned, the therapy where you have them in a building that has multiple stories or climbing upstairs, something like that. And you show them rationally, you're not going to fall, you're not going to die, nothing bad is going to happen to you. So you should get rid of that irrational thought and replace it with this rational one where everything's fine if you're in a safe building. even if you're on the second or third floor, something like that. Many of the examples of behavioral therapy are also used in cognitive behavioral therapy, just with the addition of the cognitive component, okay? Yeah, and like with these disorders, depression, bipolar, some of these you should know some like schizophrenia and like the actual biological causes of these for the MCAT, but you don't have to know every single aspect of it because they'll usually tell you, but you should know some of them. The next therapy we want to talk about is humanistic therapy, sorry, which is a little bit different from the other two that we've talked about so far. So humanistic therapy actually focuses, we're moving away from behavior into more thinking now. Humanistic therapy mainly focuses on yourself and how your thoughts and views could affect the choices you make and the trajectory of your life. This therapy utilizes unconditional positive regard with focus on the positive aspects and acceptance rather than any negative aspects. So this is kind of, if you've seen like maybe some kind of other therapy like intervention or something like that for people with self-esteem issues, something like that in shows or movies or in any kind of media. This is what the type of therapy that they were doing, humanistic therapy, where they're telling the people who have the trauma or the depression or whatever that it's okay, you'll get through it, and like this is how your choices could affect it. It's good that you're on this path, but they don't do anything to criticize the people regardless of what they do or say. They try not to criticize it, but rather give them like positive reinforcement rather than negative reinforcement, and kind of guide them, not exactly guide them, but kind of help them guide themselves essentially, rather than tell you this is what you should think, rather kind of guide them. How have your actions so far affected your trajectory in life, and how could, by changing your actions just a little bit, how could that affect your life in a different way, or how could that do something different for you, right? Like I mentioned, it's commonly used for self-esteem issues, feelings of worthlessness, trauma like PTSD. It's commonly used for veterans, or any really kind of trauma, childhood traumas or anything like that. Depression, relationship issues like trust issues, things like that. Some examples are Gestalt therapy, which it looks at unresolved issues like family trauma or relationship conflict, and it focuses on role playing with the therapist or the doctor to change how these situations affect your emotional states. This is more focused on the affective and the cognitive rather than the behavioral. Through the use of role playing with the, you will hopefully, the aim of this is to see that by role playing, you could kind of see how it could have gone differently, or how it has affected your life even now. Something from very long ago has effects on your life now, and you could change it just by accepting or moving on or doing whatever. Okay. Next is another example is existential therapy. So it talks about the aspects of your life, what meaning they have, focus on how you can get more out of your life and your experiences, again, just like walking you through it and kind of talking about how your actions affect your life and what effects your actions have on other people's lives, and the kind of like the meaning you get out of everything. Okay, so again, you don't really have to memorize these subtypes theories like the Gestalt therapy or existential therapy. Just know that if they describe them, that they're aspects of humanistic therapy, and I'm just giving these examples just so you have an idea of what humanistic therapy actually looks like in real life. Okay. Next therapy we're going to be looking at is psychoanalytic therapy. So while the others were usually a couple months, psychoanalytic therapy can take years and years, and it's like a very consistent thing that you go to. It's very, very long term. This one focuses very deeply on the subconscious of cognitive, affective, and behavioral aspects. So if you've seen it in like movies, shows, media, or anything like that, the one where the person's going to a therapist for a very long time, they're talking about, so what are the subconscious like roots of all your actions, or you do this because subconsciously you have issues with your father or mother, or you do this because you have trust issues subconsciously, and that's what affects your behavior today. This is the type of therapy. It's psychoanalytic, where they analyze you. This therapy focuses on finding the unconscious causes and connections for the patient's thoughts, feelings, and actions. So this type of theory says that every action, every thought, every feeling you have, it has some kind of deep motive deep down that even you are probably not aware of, that causes it or that kind of motivates it. And if we find the cause, and we can change it. But that's the only, that's like the main way. So it hopes to change these aspects, like your thoughts, feelings, actions, by finding and addressing the root cause of these issues. Again, some kind of trauma or relationship you had many years ago with your parents, or a loved one, or event you had, or a fear of something that you may have had, or I don't know. It's commonly used for depression, substance abuse, eating disorders. Why do you have this eating disorder? Why do you have this substance abuse? What are you trying to like replace with these drugs? What are you trying to replace with the food or the overeating if you're binge eating? Or why are you trying to slim down so much if you're like anorexic or something? What is the reason behind it? Or for depression, what is the deep down reason for it? Okay, so this is the last type of therapy that I really want to cover. I'll be covering actually another one after this, the click question, but these are the main ones that are tested. The other one's not really. That one's more for just your knowledge. For psychoanalytic theory, like you may have noticed, I didn't have any examples, but because this one is actually very commonly portrayed in things like movies and media, and I think this gives you kind of like a good idea of it. And also, there's not really that many common examples of it, other than just what you commonly see. What is the root cause? Before we move on to the quick question or the poll question, does anybody have any other questions? So I know in the chat people were asking about bipolar disorder, bipolar depression. That's especially like with the bipolar stuff, that's a little bit more out of scope of the MCAT. They were really going to go that in depth with bipolar, like what it was, what the causes were, the treatments are. It would be in a passage where they would tell you all that information. So I don't want to go too deep into bipolar specifically, but bipolar, as Chris mentioned, is just mood disorder. It's kind of depressive, hypermanic episodes. Could be also, it's just changing moods, right? If you want to think of it that way. But there are like, if you want to think of it like bipolar as changing moods, that's one way. It does go a little bit deeper than that, but it does beyond the scope of the MCAT. Yeah, and actually somebody mentioned in chat, the movie Psycho is a great example of a time when you would use psychoanalytic therapy, and the psychoanalytic theory behind this therapy is what is commonly used to analyze that movie and analyze that character, right? He has a subconscious or unconscious opinion about his mother, or like the verbal abuse or whatever he experienced as a child, and that's why he's a murderer now, right? That's the root cause of his murder tendencies. He himself may not realize it, but for us, like his is extreme, so we can see it right away. But usually, the causes and like the effects are usually not as simple to see. So that's why you need a therapist for it. But yeah, there's a great example. Thanks for mentioning that. Okay, going on to the next poll question. This one's a little bit more straightforward. Sorry. Okay, poll should be up. This one's a little bit more straightforward. Okay, take another maybe 30 seconds to a minute to answer this. Okay, I'm gonna end the poll. Okay, so the majority of people picked answer choice B, which I think is which is the right answer actually. So yeah, that's great that you guys got this. So first clue was the use of problem-oriented strategies. That leaves it down to some type of behavioral. So it's not humanistic, which focuses more on like your thinking and your kind of view of the world, which I would say is a combination of more cognitive with a little bit of affective, and psychoanalytical, which is more just finding the root cause. It's very talking heavy rather than problem orientated. A low number of patient-doctor sessions. So usually cognitive and cognitive behavioral and behavioral therapies, they usually have lower number of sessions because usually you can either get the problem behavior out quickly, or you don't get it out, and it doesn't matter how many sessions you do. So either it works quickly or it doesn't work at all. So there's no point in having more. Whereas something like psychoanalytic and maybe even humanistic could be ongoing, recurring. Even humanistic, it could take a while. Right. The reason we eliminated C is because humanistic is, like I mentioned, it's giving the positive reinforcement, sitting down and like, if you know those kind of like in media, if you saw the PTSD for veteran, those types of meetings where they kind of talk about how like your life after the war changed and like what your view is and how you think and all of that stuff, that's more humanistic, and you give like positive give like kind of like positive effects, especially after like some kind of trauma like PTSD or anything like that, or feelings of worthlessness, kind of change their thinking and then see how the change in thinking affects their actions, rather than using problem oriented strategies like aversion therapy or something like that, which is more like hands-on, I guess. And again, these two would also use a higher number of patient-doctor sessions, right? Because they're a lot more talking and they're more long-term. Whereas these, they're very quick, or not, I shouldn't say quick, they're more short-term. So it either works in a couple sessions, you see some kind of improvements, or it doesn't really work for that certain behavior, right? And then having a long-term thing is not really that important. And then the reason you would differentiate B over A is this: the assignment of at-home exercise. The assignment of at-home exercises would eliminate choice A and stick with choice B, which I said, like something like the journal, for example, to write down your thoughts every time you have an intrusive thought or something like that. So that's why B would be the correct answer, and most of you got it. Yeah, so on a real MCAT, they most likely won't give you this type of question. This one is a little bit like more for your understanding. The way they would actually give you this type of question is they would have you, I'm gonna clear this, they would have you figure this out. Like this part, they would have you figure out. So they would give you a passage where they maybe, or in the passage, they have a paragraph describing the type of therapy that they're using. And then you would have to decide whether it uses problem-oriented strategies. You would have to decide. You would have to like find how many patient-doctor sessions it has. You would have to find if it has at-home exercise or not. You would have to find that information, and then they would just ask you simply, which of these types of therapies is the one mentioned in the passage? They would just ask you essentially like this part, and this part you would have to figure out. All of this you would have to figure out on your own based on the passage. This one was a little bit more straightforward because I gave you all that information. But so in this sense, for this type of question at least, it comes down to a combination of actually knowing the different types of therapies and their definitions, and also extracting information from the passage, which is very important for the MCAT. And the best way to do that is just to keep practicing and doing a lot of MCAT passages. Okay, any questions before we move on? Oh, when couples do role play, so that kind of depends, and but that I would say is a little bit more humanistic than anything else. So if I'll go back to, yeah, so role playing change how these, yeah, it does have aspects of behavioral in there a little bit, but really when you do the reason you do role play is to find out the kind of like how your thinking can affect your relationship. How does my thinking of, for example, trust issues, if I have trust issues, how does my thinking of this person's untrustworthy, or they're going to cheat, or they're going to lie, or they're going to do whatever, how does that actually affect the relationship? And role playing kind of explores that more. So that would be more humanistic. You could also use, I guess, role play to find psychoanalytic, right? You could use role play to figure out what the deep down reason is, but that would be more role play with a therapist, like for the therapist to find out. Okay, but mostly, if anything, I would say it's humanistic. All right, so we're almost done. The last thing I want to touch on is, like I mentioned, there's one more type of theory. It's biochemical therapy. There are other names for like biophysical, I think, therapy was another one. It's very rarely tested. It's kind of, if you see it on the MCAT, it's most likely not the right answer. But it may, but just in case, I'm telling you, and this also if you're curious as well. So this is a much more recent type of therapy. Instead of focusing on your cognitive, affective, or anything like that, on your attitude or behavior, it thinks that the only thing that affects your attitude or affects your behavior or your affect or anything else like that is purely the biological chemical. So why are you angry? Well, because you have a chemical imbalance, or you have a certain chemical state, or whatever. Why are you acting this way? Well, it's because you have this gene, or you're producing too much of this hormone, or this protein, or this whatever. Focus on the actual biology and the chemistry, instead of the actual I don't know how to describe, but like the human aspect, or like the thinking aspect. Focus more on the actual biology and chemistry of behavior and attitude. So how would you fit if you think that the only reason you're angry is because there are chemicals in your brain that are telling you to be angry? The only reason you're performing these actions is because you have a gene that produces a certain protein that triggers certain hormones that have you perform an action. How would you treat that? Well, you would just give them other drugs, or give them other molecules, or you would do something else, right? Something biological or pharmaceutical to treat it. So it could be like inhibitors for enzymes, could be supplements for vitamins and stuff if you're vitamin deficient or something like that. Could be different proteins or hormones. It could be, is a very common one. Basically, it gives you like biochemical and pharmaceutical drugs to treat your psychological problems, or to give you therapy, right? And this is actually commonly used. Like how do a lot of people treat depression? Well, you have antidepressants. How do you treat something like insomnia? You have drugs that make you go to sleep, right? Sleep-inducing drugs. It's not. Yeah, that would be exactly biochemical therapy. Would be a primary care physician or any kind of doctor giving you antidepressants, giving you sleep pills, giving you whatever else. That's the biochemical approach to therapy. Typically, it's actually a psychiatrist that usually gives these mood disorders. Sometimes PCPs can give it to you, but usually it's psychiatrists, especially for like schizophrenia and more advanced psychiatric disorders. it's usually a psychiatrist that gives out those drugs. So that's why it's like more in psychology section. But yeah, that's exactly what it is. And that's why I say it's a little bit newer, because we're only recently starting to kind of get involved with that. Before, actually, historically, we've also tried doing similar things with like lobotomy, but those didn't work very well. But yeah, now we have drugs. So that was the end of the lecture. I'm gonna stop